Have you ever had stomach bloating after eating outside and thought, okay, maybe it's just gas? Or maybe you have had loose motions during stress and blamed it on anxiety? Now, here's the problem. Sometimes it actually is something simple like acidity or IBS. But sometimes your body is trying to warn you about something much more serious, inflammatory bowel disease or IBD. And this is where things get confusing because IBS and IBD can look like cousins. Both can cause abdominal pain, bloating, altered bowel habits, urgency to use the restroom, and unpredictable gut symptoms. So people often say it's probably IBS only. But here is the catch. One condition mainly disturbs the bowel function. The other can actually damage the intestine. That's the difference between discomfort and disease. And missing the difference can delay diagnosis for years. Today, we are going to understand what IBD really is, how it differs from IBS, the warning signs people ignore, why early diagnosis matters, and how modern medicine is completely changing outcomes for patients. Because not every sensitive stomach is just a sensitive stomach, let's understand the gut better. Before we understand IBD, we first need to talk about the confusion surrounding it. Because honestly, even educated people mix up IBS and IBD all the time. Let's simplify it. IBS stands for Irritable Bowel Syndrome. IBD stands for Inflammatory Bowel Disease. Only one letter changes, but medically they are worlds apart. Think of IBS like a software problem. The bowel looks structurally normal, but its function becomes sensitive and overreactive. Patients may experience bloating, constipation, diarrhea, abdominal discomfort, especially during stress, oversleep, or certain foods. Now let's look at IBD. IBD is more like a hardware problem. Here, the immune system attacks the intestine itself. The bowel becomes inflamed, ulcers can form, bleeding can occur, and over time, the intestine can actually get damaged. Now here is why patients get confused. Early IBD symptoms may look mild. A person may think it's just acidity, maybe food poisoning, maybe stress, maybe IBS. But there are subtle warning signs that should raise concern. Red flag symptoms pointing towards IBD include blood in stools, unexplained weight loss, waking up at the night to pass stools, fever, severe fatigue, anemia, and persistent symptoms for weeks or months. IBS may disturb your lifestyle. IBD may disturb your health permanently if ignored. And that is why awareness is extremely important. So, what's the difference between Crohn's disease and ulcerative colitis? Both are included under the umbrella of inflammatory bowel disease. Let us say about ulcerative colitis first. It affects only the large intestine or colon. Inflammation usually starts from the rectum and spreads upward. Mostly affects the inner lining of the colon. The common symptoms of ulcerative colitis are blood in stools, frequent loose motions, urgency to pass stool, mucus in stools. Now let's talk about Crohn's disease. Crohn's disease can affect any part of the digestive tract, from the mouth to the anus, often affects the small intestine. Inflammation can involve the full thickness of the bowel wall. This can lead to narrowing of the intestine, abscess formation, fistulas, and severe nutritional problems. Patients may experience abdominal pain, weight loss, chronic diarrhea, fatigue, and sometimes fever. One important question people ask is, why are we seeing more IBD nowadays? The truth is, cases are increasing globally, including in India. There isn't one single cause. IBD happens because of a combination of genetics, immune system imbalance, gut microbiome changes, environmental triggers, and lifestyle factors. Even modern lifestyles may be contributing. Ultra-processed food, lack of sleep, chronic stress, sedentary lifestyle, smoking, and excessive antibiotic use. But let me make one thing very clear. Stress alone does not cause IBD. However, stress can definitely worsen your symptoms and trigger flare-up. This is the section I really want people to pay attention to. Many patients live with symptoms for years before getting diagnosed. These are the warning signs you should never ignore. Blood in stools, persistent diarrhea lasting for weeks, unexplained weight loss, ongoing abdominal pain, severe fatigue, frequency, urgency to use the restroom, fever without obvious infection, loss of appetite, anemia, delayed growth in children, and sometimes symptoms may appear outside the intestine too. Yes, IBD can affect your joints, skin, eyes, and even the liver. So if someone has recurrent bowel symptoms plus joint pains or skin problems, that deserves medical evaluation. So, how do doctors diagnose IBD? Diagnosis usually involves a combination of detailed history, blood test, stool test, colonoscopy, biopsy, and imaging scans like CT or MRI. A colonoscopy is one of the most important tests because it allows doctors to directly see the inflammation inside the intestine. Many patients are afraid of investigations, but delaying diagnosis is often far more dangerous than the test itself. Untreated IBD can lead to serious complications. These include severe malnutrition, intestinal narrowing, bowel obstruction, fistulas, abscesses, hospitalization, and increased cancer risk in some patients. But here is the most important part. Early diagnosis and proper treatment can dramatically reduce these complications. IBD is chronic, yes, but today it is also highly manageable. This is where medicine has changed tremendously. Years ago, many patients suffered silently with very limited options. Today, we have advanced medications, biological therapies, targeted immune treatment, nutritional therapies, minimally invasive surgery if any required, and personalized treatment plans. The goal is healing the intestine, preventing complications, and improving quality of life. And surgery does not mean failure. In fact, for some patients, surgery can be life-changing and restore normal functioning. Now, let's talk about what patients themselves can do. There is no universal IBD diet, but certain lifestyle measures help significantly. Adequate sleep, stress management, avoiding smoking, a regular follow-up, proper nutrition, hydration, and medication adherence. One major mistake patients make is stopping medicines once symptoms improve. IBD often has periods of remission and flare-ups. Feeling better does not always mean the disease is gone. Let me end with this. IBD is invisible from the outside. Many patients look completely normal while silently battling pain, fatigue, anxiety, and social isolation every single day. Awareness matters, early diagnosis matters, and compassion matters. If you or someone you know has persistent bowel symptoms, don't ignore them. Seek medical attention early, because the earlier we diagnose and treat IBD, the better the outcomes. If you found this video helpful, share it with someone who needs this awareness. Thank you for watching.